Well, the older adult isolation program actually came about because of a problem that we were seeing in our community and throughout the country, really, seniors being isolated. The United Way became involved actually from the very beginning. Originally, we were on the periphery and we were going to become a collaborative partner. So we really were approached by a group of other agencies that said, can you do this? Can you take the lead role? So we stepped back and said, you know what, this is an important project. This is something that we in our community desperately need. And thanks to the Moses Taylor Foundation, we were able to pull this together. Early on, when we started the program, it was evident that we needed other assistance. So we actually wanted to have some data to fall back on when the program was running through to kind of validate its success. We also needed some consulting work from experts in the field. So we reached out to Dr. Lenny Kay. He's the director of the Aging Center at the University of Maine and a very well-respected gerontologist. The Institute for Public Policy to kind of collect the data and to keep us on track and just tell us where we're going with the program and the success of the program. And Moses Taylor Foundation has stayed with us and also provided us support, ongoing support as we went forward. So those are really the three key players that we've been working with from the very beginning. I would say early summer of 2019. So we began our work in putting the proposal together and whatnot. And we started talking to a number of agencies in the community to come together as one collaborative so that when we went to the Moses Taylor Foundation, there would be one proposal that would be presented. We received letters of support from about 30 to 35 organizations in the community. And that was somewhere around September, October of 2019, where we submitted our proposal. Say November, we were notified that we were approved and we started our collaborative work. And then March, the pandemic hit and we had to put everything on hold for a little bit. And we continued for about the next year on Zoom, planning and putting the whole program together. Once the program got up and running and we were in the planning phase, we decided to start off with a pilot. So we brought in a few other partners, community partners, to help us with the pilot. Actually, they were some kind of our referral sources.
So during our annual wellness visit for our older adults, that happens if you're above the age of 65 as part of a Medicare benefit for preventive medical care. In our health risk assessment, we ask about loneliness. So to be able to participate with this didn't take much thought or energy. Basically, wear both hats as a board member to make sure that it keeps on moving forward and how we are supporting it. And then at the Wright Center as a geriatrician, in my role there is training my learners or fellows in geriatric medicine. So I play both roles. I also have the opportunity to influence how we look for loneliness in our practices.
After several meetings with Moses Taylor Foundation and the United Way, it was obvious that the population we serve was going to benefit the most from this project. The Lackawanna County Area Agency on Aging has been a part of the collaborative from the get-go. We service older adults in Lackawanna County who are mostly 60 and older. We provide services and supports and information and referral for a lot of in-home and community-based programs. Ever since, it's just been collaboration and exciting and innovative ways that we can reach a population of older adults that we just never thought we would be able to before this collaborative started.
I was contacted by my director and asked if this collaborative would be something that I would be willing to work on to represent United Neighborhood Centers of Northeastern Pennsylvania. So the United Neighborhood Centers of Northeastern Pennsylvania is comprised of many different departments. My work is with the older adult department and specifically the Healthy Aging Campus. I'm bringing my experience, hands-on, everyday interaction with older adults. I hear firsthand what their challenges are. I feel that's a very important insight to bring to the collaborative.
So when the pandemic began to lessen a little bit, we were then able to get into our pilot program. It is a tribute, I think, to the collaborative partners that they have stuck together with this and maintained their enthusiasm throughout all this time. So this didn't happen overnight. This was a long process.
All these different insights and viewpoints on everyone's expertise with older adults is very important. I think that everybody has something to bring to the table.
We have 70-some providers and we take care of a lot of older adults. Okay, and so they need to be able to know how to recognize loneliness, not only depression, and then what to do with it. And we have trained our navigators and our participating organizations to realize they will get calls from our navigators and say that Mrs. X or Mr. X needs help, and what services that they need. Our navigator is going to help to point them in that direction.
Because they're hooked up with a navigator, there's no lag time between somebody being referred for a service or to an agency and the response. It's just been tremendous.
Now we have a streamlined, efficient manner of getting this work done that's reaching more people. And it's a ripple effect, and you get success, you keep building on that, it keeps growing. It really is a wonderful thing. So I know out of the collaborative is coming a friendly calling program. I learned, and again, I think my coworkers learned, the importance to just what a phone call does. Oftentimes, all they want to do is hear from a friendly voice to talk for 10 or 15 minutes at their loneliest time of day, which sometimes is, and usually is, the evening. Has come out of working together, and that makes, again, for just a stronger connection to the older adults in our county.
I think the secret sauce with this collaborative is that we all decided very early on that we were going to be committed to this, and we stuck to our commitment. As we got more involved with it and working with our partner agencies, we realized that not only could we provide services, but we can learn more about stuff in our community that's available for older adults.
And that's what's so great about this collaborative, is that each agency and organization is really learning what the other one does and what they can do and bring to help the community.
Working together in the collaborative really ensures that the best care plans are developed and that we're working with our community partners to close any gaps.
So I think if anyone who is venturing in on this type of collaborative, the two key takeaways I would say is, number one, have a lead organization who's trusted in the community. Number two, be open for change, because it's going to change.